Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
The last time we discussed issues that you should be on the lookout for if you getting pregnant. Today we'll continue what you should be looking out for when you are pregnant. What if at the end of the second trimester and you have just noticed that the baby is no longer moving? The baby, the movement that you used to feel before a couple of weeks, you're no longer feeling those movements again, the baby movement inside of you. So what is the problem there? The problem could be one of two things. Either the baby have growth retardation and is not growing as it's supposed to, or worst case scenario, fetal demise, meaning the baby is no longer alive. What would be the most common cause for a baby to die inside the uterus? The most common thing is the placenta. Babies get food and oxygen through the placenta. So if we have a mother with hypertension, when we have hypertension, that means we have increased velocity in the vessels, but the perfusion, the flow, will be decreased. What does that mean? In simple English, if you are a mother, a pregnant mother, and you have hypertension, this is something that you should be taking care of immediately, because your high blood pressure will definitely affect the baby. In what way? The perfusion to the baby. Perfusion meaning the blood flow to the fetus, to the baby inside, will be compromised, will be less. So what should I be looking out for? Increased blood pressure. And we're gonna touch on this point for the next few minutes because it's a very important point. So one of the complications of high blood pressure is decreased flow to the baby inside the uterus. Now, what else could cause that baby not to move or move less? We know inside the uterus, the baby is swimming in flow, in fluids. And I think we discussed this the last session, but I will repeat. This fluid is coming from where? The fluid inside the uterus, where the baby is swimming and forming like cushions, so the baby can swim and move, stretch legs, stretch arm, move from one side to another side, from up to down. This fluid, we call it the amniotic fluid. How did this amniotic fluid form? Is the baby's urine. The baby's urine is actually the amniotic fluid. So the baby urinates inside, but there is a mechanism The baby cannot just continue urinating, 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 and no recycling. So God has put a mechanism where that urine has to be recycled back. So the baby urinate, then swallow that urine, and continues again. So the baby swallows the urine, urinate and swallows the urine, urinate and swallows the urine, and this mechanism give me amniotic fluid at certain amount. It cannot be more and it cannot be less than this amount. It has to be at a specific amount where the baby is comfortable, and when the baby is comfortable, babies move. And when babies move, you will feel the movement. So this is exactly how it works. Now there are things that can go wrong, whereby this fluid could be a lot more than it's supposed to, or a lot less than it's supposed to. Let's put an example. A woman that is hypertensive, you see, hypertension is the whole core of this problem. A woman that is hypertensive, pregnant, go to a doctor, and the doctor give her something called ACE inhibitor, or a medication to lower the blood pressure, but a specific category that all those category ends with the 4 letters, P-R-I-L-L, Brill. Catobrel, there's a lot of Brills. Ramipril, a lot of Brills. Anyway, if the doctor wrongly prescribe a medication that is ACE inhibitor or any drug that ends with Brill, you should check your drug medication. Oh, I'm hypertensive. What I'm taking? I'm taking an ACE inhibitor that ends with P-R-I-L-L. I should stop it immediately because that medication have a very bad side effect on the kidney of the baby. So when the kidney of the baby is affected, that means that baby cannot form urine anymore. Remember, the urine comes from where? From the kidney to the bladder to outside, correct? So if the kidney is affected because of that medication that you're not supposed to be taking, then we're not gonna put out enough amount of urine. As a result, the amniotic fluid that is surrounding this baby will be a lot less. And that's the condition called oligo. Oligo means small. Oligohydramnios, meaning the fluid around that baby is no longer enough for the baby to move. As a result, the mother is not feeling the movement of that baby. So it all started with what? With hypertension. Then put in the wrong medication that compromised the baby's kidneys. Babies cannot urinate. Then the oligohydramnios is formed, which is the amount of urine that the baby puts out is less. As a result, we have less amniotic fluid. As a result, the baby have no space to move. As a result, you come to the doctor and the doctor find out that you have been put on the wrong medication. It could be congenital, that the kidneys of the baby are no longer there or are not formed, or something had happened to them during the process of organ formation inside the baby. So if this happened and the kidney is at risk or has not been formed or been damaged by the wrong medication, all of those scenarios lead to one thing, which is the amniotic fluid, the urine that the baby puts out, is now less. As a result, the baby has no more room to swim and to move, and you will not feel the movement of the baby as it's supposed to. This is one scenario, and it all started with, again, hypertension. Hypertension. Underline that hypertension many times. So during your visits, your prenatal visit, the focus is on hypertension. Now, what is the other scenario? The other scenario is that baby cannot swallow. Remember, the mechanism is to make the amniotic fluid, baby urinate, baby swallow the urine, and the cycle continue. So we discussed the condition or the scenario where the baby cannot make enough urine. And it all comes down to hypertension of the mother. The second scenario, there is malformation. There is congenital malformation. Something happened to the swallowing mechanism of that baby whereby the baby can no longer swallow. If the baby can no longer swallow, that means there is maybe a fistula between, meaning a communication between the esophagus, where the baby swallow, and the trachea. So the fluid is now going to the respiratory system instead of going down to the GI and then, going out. So this is a problem. So now we're talking about a problem of the GI system, of the gastrointestinal system, whereby the baby, anything that can affect the swallow, we're going to be looking for those malformations. Now we have enough technology to identify those malformations while the baby is still inside. Now, what about the hypertension issue? Yes, hypertension issue will cause the baby perfusion, meaning the blood flow to that baby will be limited because of the hypertension, and we can also identify that non-invasively by using a high technology or high definition ultrasound, and is available in every clinic now these days. You can just see the velocity, which is the speed, how the blood move along a specific artery in the brain. We call the middle cerebral artery. The procedure takes a minute. We put the ultrasound probe and we see the velocity. We know the normal. If the velocity is increased, that means there is a problem there. There is a problem there. It could be anemia, or it could be low perfusion because of the mother hypertension. All right, so we discussed that. We discussed that now very good, and we understand the consequences of hypertension. Now, we're not going to stop there, because hypertension is a big issue and is a big warning sign, is a red flag when you're pregnant. If you are hypertensive and just hypertensive, no other complication combining that hypertension, this we call gestational hypertension, and we give you medication. And we said, I think the last session, the safest medication is methyl-dopa, okay? Not because it is the best, but because it is the safest. It has the longest safety record when it comes to lowering blood pressure in a pregnant mother. Okay, so great. So that is good. So what are we going to do? Now you are hypertensive, but only hypertension. There is no other combining signs and symptoms. Like what? If the patient comes in with headache, beside the hypertension. If the patient comes in with blurred vision, beside the hypertension. If the patient comes in with a swelling face, beside the hypertension. If the patient comes in with swollen hands, beside the hypertension. That's a big warning sign now. Now we are moving from gestational hypertension, which is not very bad. It will only affect the perfusion at the level of the placenta to that baby, but we don't have major complication. Now, if that hypertension is combined with one or two of those symptoms, again, I will repeat, the most dangerous one or the most important one that you should be on the lookout for as a pregnant mother is what? Is the swelling face, the swelling hand. Those are the two things you should be looking out for.